Assalamualaikum and a very good morning to our respectful audiences. So, my name is Meor Mohamad Nurhakim, Meor Mohamad Redzuan, and today I'm going to give a speech and talk about euthanasia. Okay, so basically, these are the three topic outlines for my presentation and for my speech today, which is the definition encompasses definition, types of euthanasia, and also the decision making process. Okay. So actually, what is euthanasia? So euthanasia is actually arises from the ancient Greek terms, which is euthanatos, meant easy death. Today's euthanasia generally refers to a massive killing, the voluntary ending of the life of someone who is terminally or hopelessly ill, like brain death, comatose patient, and also abortion. And some cases, euthanasia has become a legal medical and also an ethical issue where the opinions are always divided. Either we need to do euthanasia or not. Okay, so next we will move on to the types of euthanasia. So basically there are two main types of euthanasia, which is passive and also active euthanasia. For active euthanasia, actually it means that a physician or any other medical professionals takes a deliberate action that will induce death. Okay, for example, administering an overdose of drugs, lethal drugs such as morphine, insulin, or barbiturates, followed by an injection of a curare to the patient. Okay, so as compared to the passive euthanasia actually refers to a withholding or withdrawing of the treatment which is very necessary to maintain a well-being life of the patient. Okay, passive euthanasia also means letting a patient die for lack of treatment, okay, or suspending the treatment that has begun. Example of the passive euthanasia includes taking patients off from its ventilators, okay, removing the ventilation machines, removing the food supply for the intravenously, okay, from the comatose patient. So this action actually will intentionally cause mortality to the patient. Okay. So next we will move on to the decision making process. Okay. Okay. So basically, so when we talk about euthanasia, actually it is a good deal of the controversy. Okay, there's a lot of controversy about this mercy killing system, and actually it stems out from the decision making process. So actually, who decides it? What situation that the patients are need to die? Okay. So okay, so basically this issue has not been established legally. Okay, for example, in United States, okay, the matter is left to the state law, and in particular in state law they mention that they usually allows the physician in charge to suggest the option of death to a patient relative, especially if the patient is brain dead. Okay. So there are three like components of the decision making process, or three types of decision making process that are common in this world nowadays. Okay, so for the first point, which is the flexibility. Okay, other parts of European countries and nations, okay, the decision making process has become very flexible. Okay, even in the cases when the patients are not brain dead, patients have been put to death without their consent, but okay, at the request of the relative, or at the insistence of the physician that treat the patient. Okay, so and also many cases of this involuntary euthanasia involve older people or newborn infants. Okay, so basically they are following a principle: life not worthy of life. Okay, so means a patient that suffers with a terminally ill people, so actually they have a life that is not worthy to life, not worthy of life. So they are using that principle, that they are using that kind of philosophy to permit this euthanasia. Okay, so for the second point, okay, for lenient, okay, there are also other countries where involuntary euthanasia is not legal. Nevertheless, the court system have proved very lenient in dealing with medical professionals who practice it. For example, in the Netherlands and also in Japan, okay, the physicians, if the physicians follow certain guidelines, they may actively carry out mercy killing on incurably ill people. Okay, the courts also have somewhat lenient with friends or relatives who have assisted, means they already give their consent to the terminally ill patients to die. Okay. As for the third component, which is the living will, okay, so medical advances in recent decades have made it possible to keep terminally ill people alive beyond any hope of recovery or improvement. Okay, for this reason, for this particular reason, the living will has come into common use, especially in the United States, okay, as part of the right to die principle. Okay, in which most states in the United States now legally allow the making of such wills that instruct hospital and physician to suspend treatment or to refuse life support measures in hopeless cases or scenario. Okay. So before I end, I would like to ask the audience, what would you do and what would you think? Should euthanasia still be implemented? What would you feel when the person involved is your friends or family members? What you should do as a physician in this scenario? Will you proceed or not? Euthanasia. So I will leave this as a present to the audience to take home. So that's all from me. Thank you for the listening. And these are my references. Okay, that's all from me. Thank you very much.